Hello and welcome. India's first doctor survey on the COVID crisis. You've heard of herd immunity. Today we look at herd wisdom. When 111 doctors come together, what's their best sense about various questions that have been in your mind? When can we go back to work? When will gyms reopen? When is it safe to invite friends over? We asked some of India's top doctors these questions, and we'll focus on that on our show this evening.
Nearly 5.5 lakh cases. India unlocks, virus spreads. When should schools reopen? Should you visit a salon or a gym? How long before life returns to normal? Know what doctors think. India's first COVID survey. Top focus on Newstrack.
So over the past several days, the India Today Data Intelligence Unit worked with our team to try and put together India's first Corona survey. And what I want to tell our viewers is that we spoke to 111 doctors spread across 10 cities. In every big city we took about 10 doctors, and then we worked the phone lines. There's a big Google Forms survey that each doctor had to fill up, and we're very grateful to every doctor who participated. Really the biggest names in medicine in each city joined us, took out time, and what we're doing really on this special edition of the Newstrack is to bring you their cumulative wisdom. There are no specific answers to any of these questions, but as is the case when we do, say for example, the Mood of the Nation survey, it gives you a best sense of how voters view the government's performance, and in the same way we spoke to those who have the best sense. Everybody has a view. When is it safe to go to a gym? When is it safe for schools to reopen? When is it safe to have friends over? Everybody has a view on each of these questions, but nobody knows for certain. So what we did is we dialed every doctor, spoke to them for at least 15 to 20 minutes, and over the next 40 minutes I will show you the results of India's first COVID survey. So let's get started. The sequencing is according to my order of priority as well, because the first question I wanted to put out on the Newstrack was, when would it be safe to go to a gym? So let me walk across and we'll deal with this question first, because for the last 3 months plus now, gyms have been shut and it's really beginning to get to people. So the first question that I want to take on the broadcast is, when is it likely to be safe to go back to a gym? And then we'll introduce all the doctors who are joining us on the show, and we'll start asking them why they're saying what they are. So of the 111 doctors we spoke to, about 50% say that in about 6 months, which means not in July, not in August, they're pretty much ruling out going back to a gym till the end of the year. Now that's not good news. About 22% say after 3 months, so 1 in 5 say after 3 months it'll be safe to go back to the gym. Only 11% say you can go back to a gym now with precautions. 6% say you have to wait till a vaccine comes and then you can go back to the gym. 6% say that you can go back to a gym after 1 month. 5% say never again. So the big number there, and very naturally, as you would with any survey, look out for the big number or see if there is a clash between two options and how close those two options are. That will give you a sense of what the doctors are thinking. So allow me to welcome our guests joining us for this special conversation. I want to start by welcoming Dr. Naresh Trehan, Chairman and Managing Director of Medanta, the Medicity. With us also on this broadcast is Dr. Ashok Seth, Chairperson of Fortis Escorts, the Heart Institute. We've got Professor Brahma Mukherjee, Professor of Epidemiology and Chair of Biostatistics at the School of Public Health at the University of Michigan. Giridhar Babu, Professor and Head Life Course Epidemiology at the Public Health Foundation of India. Last but not least, Sangeeta Reddy, Joint Managing Director, Apollo Hospitals. Because not just the doctors, but also how the medical healthcare sector looks at each of these questions. Welcome to all our guests. And I want to put that question first to Dr. Trehan. Dr. Trehan, many watching, especially me, desperate to hit a gym again, and really now beginning to wonder, when will we be able to go back and start working out? cumulatively it seems that 60% of the doctors we spoke to feel that only after 6 months. Why does it need to wait for so long, Dr. Trehan? Welcome.
So, as you can tell from the results of this survey, nobody really knows. This is all guesswork because we really don't know how this COVID is going to work itself through society. We know right now that things are peaking. It will continue through July. How it settles down after that is going to be the key to our future predictions. So the point basically is that gyms are actually quite a sort of a trap for spread of infection. Because of the fact that people are working together, they are exercising and breathing out heavily. How many of them can actually do the gymming with masks? So these things can be worked out. But till the peak is there, I don't think anybody should hazard going to a gym.
Dr. Ashok said, what changes 6 months later? My immediate question would be, if a vaccine is going to take about a year, year and a half, maybe 2 to come, how is it that 50% of the doctors seem to say that, okay, after 6 months it will be safe? What's the difference between going in July as compared to going in January if we still don't have a vaccine out yet?
Absolutely, you're right. The virus is going to be around for a long time. We don't know when it peaks and what is the status in 6 months' time. So let's not do any guesswork. We all know the cautions, we all know the precautions, we all know why gyms are bad. Because you breathe heavily, you touch, there's a lot of close contact, you can't wear masks while gymming. But it's so important to start thinking that exercise can actually be done anywhere. Weights can actually be done anywhere, and that's what you're taught when you travel, that you can still lift anything and still continue those exercises. All you got to do is start thinking now. Transfer your gymming experiences to situations where you can do it alone, do it in a safe environment, and do it all by yourself. And if you can do that, then you're reassured that you'll still stay fit and still actually wait for the right time when things get better, and nobody knows when. 6 months is not a time frame. It could be a year. The virus could be around for 2 years. And I think you'll have to take all the precautions as we go along and take it by the ear.
Sangeeta Reddy, from my perspective, from what I hear from Dr. Trehan and from Dr. Seth, essentially figure out where in your house you can squeeze a mini gym and get started. That's the only way. There's no point in waiting for your main gym to reopen. That could be a long wait for everyone.
That clearly sounds like what all of us are in for right now, because the scenario is unpredictable. It is hugely dependent on the discovery of a vaccine and its availability at scale. But I think there's also another factor, which is when do we peak? How many people in the community develop antibodies and immunity? And how can you configure certain arrangements? Two things remain clear. One is that irrespective of everything else, in the new normal, hand hygiene and cough etiquette is a must. Social distancing and masks will depend on the vaccine. That's the simplistic rule you can apply across the board.
Okay, I want to come now to the second question. Remember, there are 12 questions I'll take you through over the next 40 minutes. The second question, and I'm sure a question which is as relevant for me as it is for many in our audience, when would it be safe to send children to school? So let's put that on our screen next, because this again is a very important question. When can you potentially start reopening schools, start sending children to school? So now about 48% of the doctors we spoke to said in 3 months it may be safe to start sending children back to school. 48% said that you can send them back after 3 months. Let's just go to the next frame. About 27% said that you can send children back in about 6 months. 14% said after a vaccine comes. Then 8% said after 1 month. And 3% said never again. So let's just go back to all our guests, and I'll start this time with Professor Brahma Mukherjee, because she can look at not just what's happening in India but also internationally. Now, it seems to indicate through this survey that doctors feel it may be safe for children to start going back after 3 months. Is it because children aren't contracting this infection in the same way as adults are, and especially older people? What's your sense? Will it actually be safe for schools to open this year? Professor Mukherjee, welcome.
Thank you, Rahul, for having me on the show. And I think this is a really changing narrative that we have seen, that the expert narratives are changing as well as our personal narratives in terms of how we manage risks is changing as well. So if you look at the data, the rate of testing positive or fatalities are very small in children. But that does not mean that it is safe to let them go back to school without the adequate precautions, because I think they can come back, and India has a household structure where many people are living in the same household, so they can bring back, they can be carriers of the disease to the elderly and the vulnerable living in the same household. In Denmark, for example, when they went back to school, they used people have been very, very creative. They used the churches to actually take students in a bigger expanse, because churches were not used on the weekdays, and the math teacher was standing on the pulpit giving math lectures. And most of their curriculum, they tried to take kids outside. It's very important for our kids to learn, and if kids do not go back to school, then parents cannot go back to work. So I think that should be a real priority, and in many countries in Europe, they have tried to do this successfully. I saw a little documentary where kids were actually outside in the church cemetery looking at tombstones to learn about numbers. So the more we can actually think about spreading them and using all the measures in terms of hand washing, disinfecting the desks, and have curriculum outside activities, we can bring them gradually back. But,
Dr. Babu, there's a lot of frustration in my household, for example, with with these online classes. I have a young son, and for him to spend a lot of time on that computer is very, very difficult. He simply doesn't have the patience, and I'm sure this is a running narrative in homes across the country. And therefore, all parents very anxious to know whether there'll be school this year at all. Most of the doctors in the survey suggest that after 3 months, it may be safe to start sending children back to school. Would you agree with that perception?
3 months might be very optimistic timeline, Rahul. The reason is we do not know yet in terms of how the children are getting affected in India. The reason I say this is 1 in 3 children are undernourished, and all the people who have undernutrition will have poor immunity levels. So the kids might be at higher risk when they are exposed to close contact settings within a closed space. That's the first thing we need to be really concerned about. The next thing is they are at higher risk of spreading the infection to the elderly and those who have coexisting illness at the home. So for these 2 reasons, we have to wait for some more time. This is my personal feeling.
Dr. Trayan, will there be school at all in its physical form this year, you think?
You know, I will just tell you one thing, that this virus is so unpredictable and the levels are so unpredictable that we should take the decision at a given point. So say end of July, we will know where we are going. I don't think schools can start before September. I agree with that majority view that at least 3 months. And the new norm is the children have to learn distance learning. And one of the things that was mentioned by our co-panelists about going to school, maybe when the weather is better, you can hold them in open air or in larger classes where you have fewer students. So those are things that have to be worked out. And sanitization and all that and masking, of course, will be a norm for some time. But at the same time, the children, we have to measure how well are they getting educated at home and how it will affect them in the future. But I think 3 months is a given, maybe more than that.
Okay, you're saying 3 months, maybe more. Dr. Seth, what's your sense? Because parents who are watching at this time are getting pretty desperate for their children to start going back to school. Of course, they don't want to compromise health, but they want the children to go back and study in a proper classroom.
Sure. So I'm not going to repeat what others have said because timelines cannot be decided. But one thing is clear, that unlike gymming, which you can actually do at home, online education is only a supplemental education and cannot be the mainstream. There's a lot of growth and development in a child which happens as a result of going out to schooling and onto a face-to-face schooling. So clearly, whatever the time frame be, it will have to come back in a very different manner of separation, of hand washing etiquettes of children, of even wearing masks, but clearly face-to-face learning will have to come back, and online will be only a supplement. So this is totally different to gymming, which one can actually even forgo for the next couple of years, because you can gym at home, you can you can run around in a park where there's less people there.
Okay, let's come now to the next question. We're in the middle of the Grand Indian summer. Most people watching, I'm sure, desperate or ideally would like to go on a vacation. And then the question is, when would it be safe to go on a vacation? So when we put this question to the 111 doctors, and remember, nobody really has the perfect answer. There is no perfect answer, but what we're trying to do on the show is give you the sense of what the herd wisdom is. And remember, when you're doing polling, herd wisdom is actually very important because it gives you a broad trend about where things are going. So after 6 months, say 51% of our respondents after a vaccine come is second, 36% of the respondents saying that. After 3 months, say 9% of the respondents. Now with precautions, only 3%. That was my pick actually. I would have liked to go, if it's possible, with some precautions and see if we can, if you're going to be working from home, and now there's so much news anchoring happening from home as well, I thought I was at least toying, not very seriously, but toying with the idea of working from, wherever. Pick any resort that you'd like to be in or holiday home and work from there. But that doesn't seem to be a preferred choice for the medical fraternity. Why is that the case? Let me put this first question to Dr. Ashok Seth. When doctors are asked, when should you go? Only 3% say now with precautions. So you basically want people to stay home. You don't want people to go out. It's not such a bad idea. If I'm going to be working from home, many would argue I'd rather work from home from Kerala, Goa or Himalayas.
Not a bad idea. Himachal Pradesh at the moment has the least amount of COVID, as you know, and there are vast open spaces. There are two aspects to it. Clearly, holiday is not a bad situation, especially if you're going out to areas where there's going to be less COVID and vast open areas. It's actually to do with how you get there and what sort of resort. If it's going to be a congested area, what is it all about? It's all about isolating yourself, and you can isolate yourself into vast surroundings and live by yourselves, or you can isolate yourself or you can have a happy time in a highly congested surrounding. So the holiday, unfortunately, always means going to resorts which are packed, having a great nightlife, having a great fun during that time, but that's not going to happen for quite some time. Those resorts are going to go away. But what's going to come back certainly is that if you can travel safely by your own car to areas which are not very congested, where distancing can be maintained, where proper precautions are taken, where the hotels open up in a very systematic manner to make it safe for you, then those holidays are going to come back. So it's going to be a shift of a holiday, of not the congested fun and frolic, not Ibizas and the stuff like that, but it's just going to be more peaceful places where you're alone and perhaps in the middle of nature.
Sangeeta Reddy, but one of the arguments I heard against going out on a holiday is that if you're in one of the big cities, be it a Chennai, a Bengaluru, a Mumbai, or a Delhi, or Kolkata, or wherever else, you at least have access to high quality healthcare, whether it's the Fortises or the Medantas. You have proper hospitals, you can go to them. Now suddenly you're in the back of beyond, and God forbid something were to go wrong, your access to healthcare is far more limited than it would be if you're in a big city. How do you view the question about when it would be safe to take a holiday?
So I think doctors clearly are saying don't travel if you don't have to, and that's the hypothesis behind pushing back the holidays. I agree with Dr. Seth that if you find the quieter places, you can travel. And in direct response to your question, I think that we need to remember that for a majority of people, the COVID virus gives you a fever, gives a sense of body pain, but is not life-threatening. It also has a certain incubation and a window time, and it's not as if you get the virus today and tomorrow you need a ventilator. So you do have travel time. So I would like to remove some of the fears around the virus. And I'm very sorry to go back for 1 second to your last question on schools reopening. 2 points I really want to add, and one is that many homes don't have, unfettered access to a computer for children. And for a lot of our Indian school children, the midday meal scheme is a mainstay in terms of their nutrition. So I would urge all educationalists to please figure out a methodology, whether it's staggering of schools, start early, reduce the number of children per class. A multitude of methods must be used, but we have to open up schools as soon as we can. It may not be August, but hopefully, definitely by September, we have to find a way to get schools open safely.
Dr. Giridhar Babu, you are absolutely not allowed to take a vacation, but I'd like very much for you to share your thoughts about when you think it's safe for others to start taking vacations.
Yeah, one of the reasons why people take vacation is to have adventure. And I would say staying at home, taking care of your children itself is a big adventure. And also managing your work from home is also an adventure.
People have had enough of this adventure. Most people are watching you would say over the past 3 months we've had, if this is your definition of an adventure, sir, we've had enough of this. Thank you.
No, but Rahul, the point here is it's absolutely not safe yet when we don't know how the trends of infection are surging in different parts of the world. Within India also, different states are surging at different points of time. So therefore, to put a blanket statement of going to travel at this point would be definitely very difficult. We'll have to wait for at least 6 months to even figure out where one can safely travel. There are a few countries which are making travel arrangements where both countries have low prevalence of COVID-19. For example, New Zealand and Australia are considering. So those kind of options might be available when there is low prevalence, when the surge has dropped down.
But it's not stopping people in the United States from going out to the beaches of Florida and the other beach resorts, Professor Mukherjee. In India, people are very careful, but where you are, everybody says, yeah, it's holiday time, the sun is out, it's good weather, we're having a nice summer, let's go live it up. And here we've got Dr. Seth, Dr. Trehan, Sangeeta Reddy, everybody advising caution.
So I think in the US, all experts are also advising caution. Whether people are going to adopt it or not, that's their individual freedom. But I think that this is, and they are, as you saw, that there is an effect of being out in the beaches and not following masking and social distancing guidelines. And there is a huge spike, and we are into the growth rate same as in March in the United States. So we have to be, so I think the people of India are prudent to use caution. And I think we have to be vigilant in terms of taking our precautions and avoid non-essential travels. For me personally, I'm dying to go back to India and see my parents, but I am going to try to maintain a semblance of normalcy and choose the right time. And at one point of time, it's a personal management of risk. It may become that my mental health situation without seeing my parents is getting worse than taking the risk of taking an international flight. And at that point, this will become essential for me, and I'll prioritize. So I think, but as a whole community, we cannot all just run around partying and hugging people and taking vacations. That would be really, really detrimental and apocalyptic.
You know, the other very interesting thing, Dr. Trehan, is in India, people are still being careful. When I see the images being beamed out of the United States, usually the typical stereotype would be that Indians are indisciplined, they're unlikely to follow rules. Here in India, people are being so much more careful than they are in a place like the US.
So, you know, they are paying a huge price for it. It was all bravado in the beginning. Governor after governor said there's no need, you can go out to beaches, and now you see what happened in Florida, what's happening in Texas. I mean, it is foolish to play with this virus. Everybody has the same desire to go take a vacation, but you go no matter where you go, no matter how isolated the place is. If either you're going to live in a log cabin and serve yourself for everything, you may be okay. But whenever you're going to go to a hotel or any place where there's going to be outside help coming in, you never know where it's going to spread. So you saw Bengaluru, I heard a few weeks ago, oh, we are going to be the best city, we are well controlled and everything. Now it moves to Bengaluru, now Tamil Nadu. So this is an unpredictable situation. Sit tight, gauge it every month. I'm not saying you just don't move for the next 6 months or a year, but do not venture out today because it is spreading like crazy. Being a medical practitioner, we hear about it. People who have been saying that we have isolated our whole staff, we are isolated, how did we get it? There are no answers. So please, this is not the time to venture out or show any bravado.
You know, you're saying this is not a time to show bravado, and this is when I want to ask Dr. Seth, there was a perception earlier, and I know that it was shared by some doctors as well, and very seasoned doctors, that there is something about Indian immunity, whether it's the BCG vaccine or just the kind of food we eat, the water we drink, that Indians aren't getting it as bad as was the case in countries like Spain, like France, like the UK and elsewhere. Do you still generally have that view, or do you believe that just because you went in for a lockdown, the cases didn't explode, and now that those lockdowns are getting over, cases are beginning to spiral in a bad way?
Yeah, I think you know, retrospectively, yeah, we didn't have enough conclusive proof about that. We were hopefully and wishful thinking. But still, Rahul, we're having a lot of cases, but we must also remember that we're not supposed to live in fright. We're supposed to live with caution. The number of deaths, luckily, is still a lot lower than most of the Western countries. Whatever the reasons may be, that we're certainly seeing 3% or less deaths. We're seeing lesser people on ventilator, even as of today, as the numbers continue to rise. Let's hope and pray that's the way it stays. So we are still different to the West. We're not surprised about the increase in numbers. That was to happen with unlocking. That was very clear. We still have to be very cautious, and I think all we're saying is, don't live in fear. Live with the precautions. And by the way, you know those things which are happening in the United States, let's not fool ourselves. It's happening in India as well. We're just not seeing them. But if we go around, I've gone to a bank. I was surprised that the teller behind the bank had the mask on. They were actually congregating at work. The unfortunate aspect is that people at work do not believe they'll get it from each other. They think it's going to come from someone outside. And they still sit next to each other without mask on, having food, having everything. And to me, a mask on a chin is of no use. It needs to be up on the nose, and yet people just wear their masks on the chin and move around in congregations. That's where we are wrong, I think, Rahul. I still don't think that people in India understand as much as they pretend that they're understanding.
That's important. I want to come to the next question. Again, each of these questions are straight out of my list, and this question has to do with going to a hairdresser to get a haircut. I desperately need a haircut, as I'm sure most people do. Some have tried the Atmanirbhar style of getting haircuts. It's a bit of a mess. But when would it be safe to go back to a salon? So after 3 months, say 28% of our respondents. After 6 months, say 26% of our respondents. Now with precautions, say 21%. 1 in 5 say now with precautions. After 1 month, say 19%. After a vaccine, say 3%. So let me put that question first to Sangeeta Reddy, because a lot of people would be veering to the idea of going back to a salon with some precautions. Why is it that so many doctors seem to think that it's better to, you know, not go to a salon at all, look like a complete royal mess, but not go back to a salon at all?
So clearly, Rahul, a salon is a place with close contact. Also, one of the other aspects about the virus is that the risk increases with the length of time that you're in contact with the person. So passing by each other, sitting close for a few minutes is different, but in a salon you will spend half an hour and be in close contact. Even if the beautician or the therapist is wearing a mask, you still have multiple surfaces of contact, so the risk is high. And like you, I think all of us have longer hair than we've had in a long time. So, but we're learning to manage. I think there are a lot of home remedies coming up. I think this is one thing that you can forgo for a while.
It's just, yeah, of course, it's very easy to say, forget it, don't do this. But what about the idea, Dr. Trehan, of calling somebody over? Now you've got urban clap and what have you. You just give them a call, they come over, they're supposed to be wearing, I haven't tried it yet, but some of my friends have, and they have a PPE kit, they come with face shields. Would you try something like that?
Yeah, I think, you know, there is one part that like underneath all this, there has to be a gradual effort to bring things back to the new norm. And the new norm is taking all the precautions you can. So what are the precautions? If both people wear a double mask for that encounter, maybe the person who's giving the haircut or whatever wears an N95 with a shield and stays as, you know, some distance, and make it quick. It doesn't have to be an hour or two, maybe 10, 15, 20 minutes, because we have allowed airlines. Don't forget, we debated it for a long time. We have prescribed how you can fly, how the distances can be, and even if somebody in the middle seat is sitting there, we will give them a PPE wrap, just the gown. And so I think that we will have to take some measured risks, because we can't just be frozen forever. But like I said, if a salon has one person coming at a time, or there are two parts to it which are wide apart, and they take all the precautions, I think we can start moving in that direction. So let the young, what did they do in Europe? They recommended that the young should go first, because they are the least vulnerable to having serious consequences. Let the older people, 60 and above, not venture out into these things.
But the difference between Europe and India, sir, is that in India very often the young come back and live with the old, whereas in Europe many of the older people tend to live by themselves.
Yes. So that's not the situation where you want to recommend it. There are small children in your house and elderly in your house, don't do it. I'm saying that if you are in the middle group, so you're talking about from 18, 20 to 45, 50, even then you have a slight danger in, after taking all these precautions. But they are the ones who have been the frontier of trying to open up things. Now, if you go stupid and go to a pub and start celebrating with 20 people without a mask and boozing, of course that's stupid. But when you talk about, say, a salon, where they have prepared everybody in one way or the other, then you may be able to do it and say, go for a quick haircut or something like that. With your N95 mask, don't talk, just get your haircut done and leave as soon as you can, and let the sanitization be done properly.
In the way that you're describing it, it almost feels like a counter-insurgency operation, where you're somewhere in the Kashmir Valley, you're going after some terrorists, and you need to be very careful lest you step on any landmine. That one question which I'm sure is in the mind of many of our viewers about when would it be safe to go back to work. Not work from home, but actually go back to your office. So 3% of the doctors we spoke to said that you can go back after, 30% of the doctors we spoke to said you can go back after 3 months, 29% of the doctors we spoke to said you could go back after 6 months, 22%, 1 in 5 said you could go back now with precautions, 16% said after 1 month, and after a vaccine only 3%. So essentially, between 3 and 6 months is when 60% of the doctors think it will be safe to go back to work. Would you accept that, Dr. Giridhar Babu, that in about 3 to 6 months it might be safe to go back to work, because people also sitting at home are now just reaching a point where they really want to go back to their offices and have the kind of water cooler conversations they did, go sit in the cafeteria, have food with their office colleagues? When would all that be possible in your view?
Yeah, Rahul, I think this has to be tailored to which state we are in India. And there are states which are seeing surge in cases now. Responding to Dr. Trehan's earlier assessment that Bangalore did well earlier, yes, we did earlier, that's why the peak is lower. So therefore, when it's surging now, we'll have to be careful in Bangalore now. Hyderabad also saying, one of the things that we absolutely have to tell everyone is above 50 years, it's safe to continue to work from home for some time. And for those cities which are seeing surge in cases, at least for the next 3 months, we'll have to be careful till the surge comes down. And in places where it's reasonably low prevalence, there we can start going to the offices. But however, we need to remember, in the offices, it's a closed space setting. Whenever you are meeting anyone, you will have to be wearing a mask, and there has to be physical distancing whenever there are workstations in a closed setting. So this is absolutely essential. That's the only medicine we have right now.
Professor Brahma Mukherjee, in our office, and I'm sure elsewhere too, they're now looking to, set up temporary shields. You've got these plastic kind of shields which go up around every workstation to try and make things safer. Would things like that really reduce the risk in going back to work? Would you agree with the assessment of majority of the doctors that between 3 and 6 months, maybe it will be safe to go back to work?
So this is a hard question, and in the US we are grappling with this because the University of Michigan, where I teach, for example, announced an in-person fall semester. So we are thinking about the minute details of going back to work, and we are working really extensively to make the workplace safer for the employees and the students that are going to come back. And that includes temperature checking, symptom reporting when you enter the building, as well as hand sanitizer stations. Those water cooler conversations are probably not going to happen for a long time, because water coolers, coffee machines, these are places of high touch, and we really have to give up a lot from our work life. But think about again, what is the essential that needs to be done? And the digital divide is not affecting everybody in a uniform way. Families with young children who cannot go back to school are being affected in terms of productivity in different ways. So we have to come back with a modulated, punctuated way of coming back to work. And it may be there is a randomized slot of 25% employees rotating through the whole week. Gradually, some face-to-face interactions are really critical to retain meaning and purpose in our work. So for that, we are planning outside face-to-face socially distanced conversations in a park. We never thought about these new ways of working and living life, but I think we have to take every pathway to mitigate and minimize our risks in terms of being behind plexiglass covers. So
what I want to do is I want to zip through to the other questions as well, otherwise time will run out and I won't be able to finish. I want to take the next question. When will it be safe to shake hands? And here what's interesting is that 44% of the respondents, which is the maximum number of respondents who were doctors, said never again. So 44%, that's almost half the sample size, says that it's not safe to shake hands again. 6%, 32% say after 6 months, 19% say only after a vaccine comes, only 1% say after 1 month it may be safe. So basically, Sangeeta Reddy, about half the doctors are saying that you may always have to do a namaste, you shouldn't be shaking hands at all.
So Rahul, the namaste is going to become the new social norm, the new global norm for greeting people, and it's quite smart. It's much safer. Let's be clear about that. There's one other point which I think is very important to make, which is that we need our elderly to go into, in a month or two, the whole population to think of a concept of reverse isolation. So if you have elders at home, it is critical to isolate them while the rest of the world starts moving forward to a near normal type scenario. So the ideology of reverse isolation is a very important message I want to leave for everyone with elderly people at home.
Okay, so Ashok say 44%, would you be in that 44%? Would you feel comfortable shaking hands if I were to meet you? Or you would say dur se namaste?
Oh, it'll always be namaste. In fact, it's great things that we've learned during this time. We've learned to do namaste, we've learned to wash hands, we've actually learned some very good things which will stay with me forever. There's no reason not to do this and shake hands. So Dr. Sarita actually said the very correct things. And again, I want to emphasize that whatever we do, whatever precautions we're taking, we must remember that we'll have to get back to life, we'll have to get to a norm, but we must remember what we bring back to our homes. So while there is all that happening around us, if there are elderly, if there are people to be safe, if there are children, we actually bring in things to them, and that's what we don't want to do. So we want to continue the precautions all the time, if not for ourselves, for our families as well.
Okay, I come to the next question, and as I said, I need to zip, that's the only way I'll finish. When will it be safe to invite and visit friends? If it's a small group, by and large, your friends are being careful. Would it be safe? So 32% say after 6 months, and that's the most important, because many people I know already experimenting and toying with this idea, but 32% say only after 6 months, 26% of the doctors say after 3 months, 18% say after you get a vaccine, 16% say now with precautions. But essentially, Dr. Trehan, only 16% of the doctors we spoke to are advocating going and meeting your friends and family even though you think you're being careful and they're being careful, which means a lot of people who are watching you at this time are probably defaulters.
No, it's very simple. We have elucidated very clearly what you need to do for protection. You can't stop living, so you practice those 3 mantras that have been talked about every day, hundreds of times on every TV channel. So, hand hygiene, masking and distancing. If you can do that and you go to meet people, only who are maybe 2, 3 at a time in a space where you can maintain social distancing, well-ventilated place. Don't start taking off your mask because you're going to have dinner together or things like that. Those are the dangers. But if you can, and if you can meet in an open space, even better. So if you keep your distance, you keep your mask while you're in a closed space, if you have a fan, put it on full so that the air circulates. Now, these are things that you need to incorporate in your life.
Have you, Dr. Trehan, invited friends and family over?
I'm sorry?
Have you had a chance to invite friends and family over?
Not to my house, but I have visited one or two friends. Yeah, with sitting 8 feet apart, just being able to talk things over. There's nothing wrong with that.
Dr. Seth, would you agree that if you're being careful, instead of living in an igloo, if you're being careful, it may not be a bad idea to go meet your friends and family? Just keeps you safe.
In fact, I will also say, to the extent that I've taken my 95-year-old father in my car to actually meet my sister, and we've sat aside, and that was a great social upliftment for him. He's been locked up in the house for literally now 4 months and feeling very frustrated in his room. I took him out, and I think it was great social upliftment for him. He actually enjoyed that memorable day. So I think if we take all the precautions, we finally have to understand we've got to get back to a normal with all the precautions. That would be the new norm. The new norm is not isolating yourself actually in an igloo and then coming out 6 months later to see whether the world still exists around you. It is, you still have to live in the world. You just have to define how. And we are doing that. By the way, the haircut issue, I've had a haircut. If you last saw me, they were going so long that it was getting intolerable. I made sure that I followed the norms of getting it done safely, and I had a haircut done, and I'm still doing okay.
So once again, how did you do this, Dr. Sid? Did you go to a salon or you called somebody over?
I went to a salon. I went to a salon. I made sure I was the only one in the salon. I paid extra for that. I made sure that he had an N95, that he had a visor. He cleaned his hands, and exactly like we're talking about, had a fast haircut. I just said, cut it as short as you can, and I'm about to go. Yeah. I wore a mask during that time. Actually, you have to define ways. I don't want to do it for the next 3 months, but at least you have to, when you get frustrated to an extent, that then you have to do an essential. I'm not saying non-essential. You do your essential acts because you've got to get back to life, and you do it with care.
You know, I hope my wife is watching. I suggested the same to her over the weekend. I was vetoed. She said, absolutely nothing doing. You stay at home. You're not getting a haircut. You don't need it. And that's it. So I hope she's watching. Good. Yeah, I hope she's watching. And then, you know, I can say if Dr. Ashok said did it, then surely I can be given some leeway as well. Okay. When will it be safe to go to a religious place? After 6 months, say 43% of the respondents. After 3 months, say 20% of the respondents. Now with precautions, say 15% of the respondents. After there's a vaccine, say 10% of the respondents. Now, after 6 months, and is that probably because, Dr. Giridhar Babu, of how crowded religious places tend to be? And we've seen in so many instances that lots of the super spreader events actually happened at religious congregations.
Yes, Rahul. And I have I tweeted about this earlier. Gods can wait. And we keep forgetting that God is universally present, and yet we would want to go only to the religious places to see whether God is there or not. So I think this is the time for testing the faith also. If you believe in God, stay at home and make sure your prayers are answered, not just for yourself, but for everybody else.
But many who are watching,
these are variants.
Sangeeta Reddy would say, when you go to God's home, you are Bhagwan Bharose quite literally, and God will take care of you. And therefore, you know, whoever their God may be, a mistaken notion would be that, okay, when I go to a temple or a Gurdwara or a church, my Lord will take care of me. Sangeeta Reddy?
So, Rahul, I think that, you know, we've spoken about a range of things, and, you know, I congratulate you for really getting doctors' opinion on this. The universal thread that's flowing across is that, number one, you have to continue to take safety norms. So if your temple is one where they're able to keep the distance, where it's not overcrowded, and it means a lot to, you know, some elderly aunt of yours, then help her go to a temple. I think the second important norm is that people are different. Somebody finds a haircut more important, someone finds a temple more important. So people are going to behave in whichever manner gives them the most pleasure. We need to now ensure that the narrative is about their safety, society's safety, and safety of the elderly. Weigh the balance, decide the behavior.
Okay.
And the answers will emerge from that framework. So if my mother-in-law wants to go to the temple, I'm going to make sure that it's empty, and I'm going to make sure I take her there.
Sure, but many people don't have that option of ensuring that a temple is empty or the salon is completely free of other people.
Lots of temples are organizing themselves so that they say only 10 people come in.
Sure.
Tirupati has opened up, but ultimately I personally agree that God is everywhere and you can pray wherever, but we must accept the fact that, you know, the world is made up of all kinds of people. And
I want to come to the next question because we're running out of time. So when will it be safe to hug someone? 36% of our respondents say after 6 months. 27% say never. And this really irks me because 27%, which is 1 in 4 of highly qualified medical practitioners of India's finest doctors, seem to believe that it's probably not going to be safe to hug anyone, never. Like, just never ever hug anyone again. That's not a good feeling. 25% say after a vaccine, which again isn't good because the vaccine could be a long time coming. So essentially, if you are looking to hug someone, this could be a long wait. Let me just come very quickly to our next question. When will it be safe to stop wearing masks? You know, only around the time when I'm not anchoring is when I'm not wearing a mask. Otherwise, whenever I'm in office, we just have the mask on, and beyond a point, it really does get frustrating. So after 6 months, say 44% of our respondents, never again, say 26% of our respondents. Basically, they want us to have a mask on for the rest of our lives. 22% say after a vaccine. So the broad sense from these three answers, Dr. Trehan, is these masks are going nowhere. They're going to be a part of our life for a long time.
So the interesting fact, Rahul, is that you are talking to people who, like us, we go to work every day. Even now, seeing patients, we are exposed to it every day. And the only precaution we are really taking is our N95 mask. If we are in close proximity to patients, we wear a shield. We keep the patients, if they are coming just for a consultation, they must wear a mask also. We are operating all day. So for us, this exposure is omnipresent. But we are taking all the precautions that we can. So now the point is, mask is your new norm for sure, till you are sure that COVID-19 has disappeared on the face of the area where you live in. Now, Czechoslovakia showed a very early sign when on day 1 they started masking, and their surge was the slowest, and they had the least infections and death rates. But India, people, like somebody just said already, you know, people still take down their mask to talk. I mean, that's when you really need it. That's when you need it, because you are exposing the other person to it. It's a well-documented thing. If both people are wearing a mask and the encounter is less than 15 minutes and it is further away from 3 feet, the chances of catching it from anybody becomes minuscule.
Oh, that's interesting. So, especially some of our netas, if you've been watching news TV, when they have their mask hanging below their nose, they think they have it on, but actually they don't. This has been a fascinating conversation. As I said, there are no definite answers, but this is the best sense of what herd wisdom suggests. And herd wisdom in any poll is generally very useful. And we've had some very interesting insights from these top doctors. So I want to thank very much Dr. Ashok Seth, Dr. Naresh Trehan, Dr. Giridhar Babu, Professor Brahma Mukherjee, and Sangeeta Reddy for joining me on the Newstrack. There are some questions I couldn't get to. So if you want to see the rest of our survey, you need to go online on the India Today website and catch the 2 other questions which I couldn't get to. There has to be some reason for you to go read the rest on our website as well. So thank you very much for joining us for this special broadcast. I hope you found it useful. Hello everyone, this is Rahul Kanwal here. Hope you enjoyed this video. For the latest news and analysis, like and subscribe the India Today YouTube channel, and don't forget to press the bell icon to stay updated.